This is Lisa Iguchi with the Oregon Health Authority. This is a quick learn video to provide some information on the updates to the optional COVID-19 vaccination Excel tracking tools. These tools have been updated to reflect changes to the up-to-date vaccination definition for COVID-19 vaccination reporting purposes, as well as to add an option to select the updated bivalent booster as a dose type. I will also provide a demonstration on this video to show how to transfer your data from your current tracking tools into this updated tracking tool. I first want to mention that the up-to-date definition for reporting is going to change on the week of September 26th. So starting the week of September 26th, someone is considered up to date with COVID-19 vaccines if they have received their completed primary series, as well as received the updated bivalent booster dose when eligible. Additionally, if anyone has received their last vaccination dose within the past 2 months, they are not yet eligible to get the updated bivalent booster and would also be considered up to date. On the tool, there is an option, or there is a link to the CDC guidance document that provides further information on the new up-to-date definition. Additionally, for the boosters, there is an option to select from the drop-down the updated bivalent booster dose. This is an option for your first booster, second, or third, depending on how many booster doses the individual has received before getting the updated booster dose. It is going to be the first option you can select. We recognize that the up-to-date counts will likely decrease from what is currently reported with this new definition, as not everyone who is eligible may yet have gotten the updated bivalent booster. We recognize that there may be limitations in supply that may cause this, or that there are still scheduled clinics to be done to get your staff and residents vaccinated with the updated booster. This information for us is really helpful for us to be able to track who has so far gotten their updated bivalent booster and where there are gaps or where assistance may be needed for us to make sure that those who do get the booster, those who do need the booster are getting the boosters or do have access. If you're using the COVID-19 vaccination tracking tools and want to transfer your data over to these new updated tools, I'm just going to show a quick demonstration using these staff tracking tools and some sample data. So whenever you transfer your data over, you want to be sure you're copying all of the information from your prior tracking tools. So you want to be able to copy data from column B. So for your staff, that would be your start of employment dates. For residents, your resident admit dates, all the way until the column that provides information on second booster dose manufacturer. So for the staff tool, that's column B. For the resident tool, that's column U. Select all of your data, copy it, which I've done in this example here already. I've copied the data from my prior tool, and now I want to paste it in to this new tool. So I just select this first cell here, and I want to right-click because I want to paste these as values. So I want to paste my data as values. I go to Paste Special. I select Paste Values here, and that will populate the data and copy it over from my prior tracking tools into these updated tracking tools. You can just quickly look through to make sure things look complete and fit where they're supposed to. And then if you have anyone who's received an updated bivalent booster, you can go ahead and document that information here. So for example, if I had someone who just got the bivalent booster dose last week, and they've already gotten 2 booster doses, then I would document it as their 3rd booster dose and select updated bivalent booster. If someone has only gotten a 1st booster dose and not the 2nd, but then just got their updated bivalent booster dose, that would count as their 2nd booster dose. So you would put it in this column, and again, select updated bivalent booster dose. Now these 2 individuals will be considered up to date because they have gotten their updated bivalent booster dose. And we can check this here by looking at this last column, which will auto-calculate for you as yes if anyone is up to date. Now, as always, if you go to the weekly summary tab, you'll see the calculations. And by default, this updated tracking tool is selected as September 26th as the first week. Please make sure that you're always updating this to make sure you're aligned with the reporting weeks. For questions 1 through 4, the information should look pretty similar in terms of how many staff are in your facility, who's gotten a primary complete series, who has any declinations, who's received any additional or booster doses. But what change you'll see here is the up-to-date counts. Again, even though many of your staff may have gotten the original booster doses, if they have not received their updated bivalent booster dose and they're eligible to, then they won't be included in these up-to-date counts. So as I only put in 2 people who received their updated bivalent boosters, the up-to-date counts is just at 2. Please go in here and update anyone who's received the updated bivalent booster in these columns. Select the updated bivalent booster as your drop-down option. And please do this before you go in to report the weekly summary counts starting the week of September 26th.